If you are diagnosed with invasive breast cancer and need surgery, you will also likely to have surgery to the armpit or axilla in medical speak. Why is that? That is because if the cancer has started to spread to other parts of the body, the first place it will usually travel to is the axilla. Hi, my name is Dr Tasha and I'm a breast surgeon. There are two different types of axillary surgery: sentinel lymph node biopsy and an axillary nodal clearance. And in this video, I will talk about a sentinel lymph node biopsy. If you want me to talk about what happens in an axillary nodal clearance, let me know in the comment section and I will do one video on that as well. So when you first come to the breast clinic, at the same time as the breast scan, you will also have an axillary scan to check out and see what the glands or nodes look like. If they look normal, well, that is great news. But to be sure that none of the nodes have cancer cells within them, we always check by removing a few at the time of the breast operation. So a sentinel lymph node biopsy is actually an operation where we remove anything up to 4 nodes from the axilla. You may wonder, how many nodes do we have in our axilla? Well, that number actually varies from one person to the next. Some may have 8, some may have 28. Sentinel means guard, and so that refers to the lymph node or nodes that are guarding the axilla. These are the nodes that will be first affected by cancer should it start to spread from the breast. So how do we find these nodes, these sentinel lymph nodes, amongst all the other nodes that might be present in the axilla? Well, we use 2 methods. First, we will inject low-dose radioactive isotope called technetium into the breast before surgery, and that can be done either the day before or on the day of surgery. And this is usually done in the nuclear medicine department of the hospital. The isotope will be picked up by the sentinel nodes, which can then be located by using a probe in theatre. And the probe is a little bit similar to a Geiger counter actually. You place it close to the axilla and it will emit a noise when it finds the important nodes. We will also inject blue dye into the breast that will also be picked up by the sentinel nodes. This dye is injected just before the operation starts, when the patient is already asleep, because the surgery is done under general anesthetic. And again, this dye will be picked up by the sentinel nodes. So the way we know which ones are the sentinel nodes is by locating the nodes that are emitting a noise with the probe and or are blue in color. So it's pretty clever. There are also different techniques being used at the moment. We can also inject tiny metal seeds, which are magnetically detectable. We also can use magnetically detectable liquid, amongst other new methods. Now, what are the possible side effects of a sentinel lymph node biopsy? Well, these are operations that are generally very well tolerated. But like any surgery, there can also be side effects. Number 1, you may get a seroma. And this is a collection of fluid just underneath the skin. It usually presents as a swelling after the surgery. The majority of the time, the body can actually absorb this, but if it persists, we can remove the fluid with a small needle and a syringe, and we do that in the clinic. Number 2, you may get altered sensation. There are lots of nerves in the armpit, and so when they get interrupted and disturbed, it's not unusual to feel a little bit of numbness and tingling around the armpit or axilla. You may also find it on the underside of the upper arm. This usually gets better with time. Number 3, one of the risks is lymphedema. And with a sentinel lymph node biopsy, the risk is about 5%. Lymphedema is where you get swelling of the fingers, the hand, and also the arm. And at the moment, it's irreversible. And if you develop it, you can get a compression sleeve to wear and exercises to do. The reason why we do a sentinel lymph node biopsy is so that it can help us decide what further treatments that you may need after the surgery, such as chemotherapy or radiotherapy, because it tells us how extensive the disease is. If there are cancer cells found in any of the nodes, then you may be recommended to have what we call an axillary nodal clearance. And in this surgery, in this operation, we actually remove all of the nodes from your axilla. An axillary nodal clearance is usually a more invasive type of surgery, and let me know if you want me to do a video on this. In the meantime, I'll see you in the next one.